Research from UNICEF and the World Health Organization suggests that only 9% of women in Ghana have access to privacy during labor. This would suggest that the rest of the women go through this crucial time with other patients present and possibly getting to know about their confidential health information. However, women at Chuchulga in the Bosa North District of the Upper East region will no longer face this challenge because a new 20-bed maternity ward has been commissioned at the health center there. The facility was constructed by the local NGO Rise Ghana with funding support from the Australian High Commission in Ghana. Here's a report by JoyNews Upper East correspondent Albert Sori.
Built in 1948, the Chuchulga Health Centre here in the Bosa North District gradually became too small for the number of people coming here daily to seek healthcare services. The situation became even more dire for pregnant women who come here to deliver their babies, as they sometimes had to take turns to deliver due to limited space available. Even to have their basic right to privacy became a challenge, as they were sometimes attended to or delivered of their babies with other patients present. However, all this is about to change following the commissioning of a new 20-bed maternity block for the health center. The maternity block was constructed by the Rural Initiatives for Self-Empowerment, Rise Ghana, with funding support from the Australian High Commission in Ghana. Awal Ahmed is the Executive Director for Rise Ghana.
Evidence from UNICEF and the World Health Organization in 2015 indicates that only 9% of women have access to privacy during labor, and a further only 18% of women have access when confidential information is being shared with them, and this is unacceptable. So this facility that is supported by Australian High Commission will contribute to ensure that women have dignity and they have access to the quality of services they need at the right place. It is supporting us with an amount of 211,000 Ghana cedis, so that through that amount, this facility, which is a 20-bed capacity with equipment and beds for 20 patients and 2 delivery units, has been set up.
The physician assistant in charge of the Chuchulga Health Centre, Albert Atuga, said the new maternity block was going to bring a lot of relief to both pregnant mothers and healthcare staff.
We used to have 1 bed, and that there was no privacy, and because of that, clients are away. There's no confidentiality of information. If the midwife or any of the consultants is giving information, the other patients sitting around listen to the private information of the client. And even when they deliver, they even lie around the same place. So it was very difficult to even have 2 labor cases at the same time. But this one, we have 2 delivery beds, half lying in, and that alone is even giving us a good space that we can manage our distance. The issue of confidentiality will be maintained. The issue of privacy too will be ensured here.
Last year, the Australian High Commission in Ghana also provided funding support for Rise Ghana to provide this mechanized water facility for the Chuchulga Health Centre.